sex ed prevents unwanted pregnancies. Unwanted pregnancies have a risk of maternal mortality. In the state of Nevada, the maternal mortality rate is very high. So we're not just having a theoretical, philosophical discussion. Sex ed unequivocally saves lives. And this is documented in the report that I have. We have very high unwanted teenage pregnancies in this country. The Netherlands has amongst the lowest in the nation because they have non-judgmental sex education. When a teenage girl becomes pregnant, the choices are all poor, they're bad to worse to catastrophic if they die giving birth. It's a small rate, but the United States rate is still one of the highest in the world. And we in Nevada have amongst the worst health care in the nation. We have the worst hospitals, the biggest shortage of doctors. We're 51st in nurses. All of these things contribute to the problem. Sex education, non-judgmental, formally education saves lives. And that's why I put my conclusion first on the very top. Sex ed, birth control pill, condoms, and legal abortion all save women's lives. Society has never been able to legislate morality. We haven't been able to do it with the drug war. It's a catastrophe. We cannot do it with judgmental actions. As a physician, my job is to save lives. Before Roe v. Wade, we had wards. I'm old enough, I was there in the 60s. We had wards full of infected women in Washington, D.C. Best case scenario, they lived and they were infertile. Worst case scenario, you held their hand when they died of catastrophic sepsis. And it affects the poor and women of color. Thank you. Rich women can always get birth control. They can always get whatever they need. Thank you very much. I leave these documents for you to consider.
Thank you.